Okay, great. I think we're recording now. Do you want to kick us off, Lauren?
Sure. Good evening and welcome to the March meeting of the Revere Board of Health. My name is Lauren Buck. I'm the Director of Public Health for the City of Revere. In attendance for tonight's meeting are board members, Chairperson Dr. Natalie Kong, Board Member Neza Luadi. Also in attendance for tonight's meeting are City of Revere staff, Paula Sepulveda and Marcia Mendez, administrative assistants. Dr. Kong, I'll pass it off to you.
Alrighty, so we only have one agenda item on today's meeting. I'm going to take us through the COVID vaccine. That's kind of the hot topic on everyone's minds. And let me just share my screen so we can see my slides. All right, so the COVID-19 vaccine, what are they? Where can we get one? Okay, so these are the current options for COVID-19 vaccines in America. Actually, hot off the press just this past weekend, Johnson & Johnson was granted emergency use authorization by the FDA in the United States. So they are currently shipping off their vaccine doses throughout the country so we can start administering that. We all know Moderna and Pfizer, those are the two mRNA vaccines that have been around for a while. So Moderna, it's an mRNA vaccine. What is that? It means that you basically have this mRNA strand, rather that codes for the spike protein. That's the little spiky guy that sticks out of the coronavirus. mRNA is basically the instructions on how to build something, anything. It comes from DNA. So we all have mRNA in our bodies. We all have DNA in our bodies. That is basically the building block for life. It's the building block for who we are. It gives our bodies instructions on how to make our ears, nose, eyes, us essentially. So mRNA is the instructions for how to create the spike protein on the COVID virus. That is packaged in lipids, basically fat. And that is what is injected into your bodies, into your arm, in the Moderna vaccine. Once it's in your body, the mRNA gets into your cell, all right, in this case, the muscle cell in your body, in your arm. And once it's inside the cell, that piece of mRNA gives our own bodies the instructions for how to create that protein. Our body creates a protein, it gets put into our cells, and that's what allows our bodies to create antibodies to that protein. Antibodies are what protects us against everything, and antibodies are what we want right now in order to protect us from the real COVID vaccine if it ever comes near our bodies. So that's what you get for the Moderna vaccine. It's an mRNA vaccine. It's been studied for the last decade or so. This is the first of its kind in terms of a vaccine to be utilized using this technology, but it's been around for a while. This mRNA, once it's in your body, it goes away after about 40 minutes. We can no longer see it in our bodies. And that pretty much tracks with our own mRNA. mRNA doesn't stick around for that long. You just need to read the instructions, build whatever it is you're building, and then you can throw the instructions away. And then this actual protein that is in our cells sticks around too, but not for a long time. It also goes away. Our body is constantly kind of building new cells and turning cells over, so that doesn't stay for a while. It only stays long enough to produce that antibody response. You need 2 doses of the mRNA vaccine. They have to be given ideally 28 days apart. The next vaccine is Pfizer, which is essentially the same as Moderna. It's an mRNA vaccine, codes for the exact same thing that Moderna codes for, the spike protein on top of the COVID vaccine, the COVID virus. Goes into your arm, just like any vaccine does. The only difference between Pfizer and Moderna is that you have to give it 21 days apart or 3 weeks apart. I believe also Pfizer, you can give it as low as, I think, 16 years old, and Moderna 18. Correct me if I'm wrong, Lauren. But those are other main differences. And those have been around since December. So we've had those vaccines. They're the ones that are being administered by a lot of health centers, CVS, the Revere Board of Health is administering Moderna vaccines. So they've been around. The new kid on the block, though, is Johnson & Johnson. This is 1 dose, which is great. 1 dose. It also it creates antibodies to this spike protein. But the difference is that it uses what's called an adenovirus vector. Basically, you have an old virus, an old adenovirus. Okay, adenovirus causes a common cold, causes a GI illness. It's been around forever. we have an inactivated virus, and that serves as, instead of that lipid particle, that's what is keeping the mRNA or the DNA in this case. That's what's keeping the DNA that is essentially the instructions for the spike protein. So a little bit different. Instead of your lipids, you have this adenovirus shell, and instead of mRNA, it's DNA. All right, but it's just one dose. Also very effective at preventing severe infections, and it's 100% effective according to current data at preventing hospitalizations from coronavirus. Vaccines work. The more people get it, the more we're going to be protected. So you'll see from this top bar here, this top kind of figure and arrow here, that when no one's immunized, the disease can spread freely. It can bounce around from the red person who's sick and contagious and not immunized, and can kind of go and spread to all the folks who are green. They're healthy, but it can quickly become this scenario. And that's kind of what we were in at the beginning of the pandemic. Now we're here. We have a couple people who are immunized, right? So there's not as many options for the virus to spread. It's going to spread more slowly, but it's still going to spread, right? You still have a lot of red between up here and down in the middle section. Finally, if we can get somewhere around 70% of the US population vaccinated, they'll look more like this. We'll still have some folks getting sick, but nowhere near what we were before. Most of us will be protected, and we'll also give what we call herd immunity to these guys in green who have not been immunized yet. We'll still protect them because there's just not as many places for it to bounce around. All right, so they work. Get it. Who is eligible for the COVID vaccine? You can see here, this is just taken directly from the Massachusetts State website. Everyone in priority group 1, so healthcare workers, folks in long-term care facilities, first responders, they're all eligible. They were eligible starting back in late December, early January. We're now in phase 2 in Massachusetts. That doesn't mean we're going to stop vaccinating those in phase 1. If you're in phase 1, you can still get the vaccine today. But in phase 2, we are now vaccinating folks above the age of, we were vaccinating only folks above the age of 75, but now we're moving on to the second stage of phase 2, and that's individuals above the age of 65. We're also vaccinating anyone above the age of 16 who has 2+ certain medical conditions. So these are all the phases that we're in. So anyone in phase 1, and then anyone in phase 2, stage 2, all right? Not yet eligible are those in phase 2, stage 3, and phase 2, stage 4, which you can see here. Hopefully in a few weeks, sometime in mid-March, we'll be able to get phase 2, stage 3 open, but who knows? It all kind of depends on supply. So what are those phase 2 eligible conditions I just mentioned? They're right here. You can see them on the CDC website. You can find them on the Mass Department of Health website as well. If you have any combination of 2 or more of everything you see on this slide, you are eligible for the COVID vaccine no matter how old you are, all right? You just have to be above the age of 16 to get the Pfizer vaccine and above the age of 18 to get the Moderna vaccine, that's all. All right. Okay, how do I get the vaccine? I think this is the $1 million question, and this is something that a lot of my patients, my own family members and friends have been struggling with. It is a frustrating process. I'm not gonna, sugarcoat that. It is incredibly frustrating, only because we have a very high demand for the vaccine and not a great supply. I just got a news alert earlier today on my phone. The Biden administration confirmed that there will be enough doses for all Americans in this country by May. So everyone will get the vaccine. It's not a matter of if. The only question is when. And that depends on how much we have now. So we're ramping up production, and we will have enough vaccines made by May, by later this year. But how many vaccines do we have created now that can go into people's arms right now? So these factories are pushing them out as safely and as quickly as they can, and they get delivered to the states, as fast as they can. But it's all coming in piecemeal. So we can't vaccinate everyone who wants it right this minute, but over the coming weeks to months, we will certainly get every single person who wants a vaccine vaccinated. So what can you do now to get a vaccine if you're eligible? A couple options. The first is the website massimmunizations.org. This website will take you to, going to this website will take you to the scheduling platform for a lot of these mass vaccination sites. So think Gillette, Fenway, Danvers, the Reggie Lewis Center over in, I believe, Roxbury. So big sites like that. And then a couple of local sites as well. I've kind of played around there and I've seen a few local sites for, say, like the Lowell Senior Center or Greenfield Senior Center, lots of other local sites that are catering to their population, their cities. New appointments are posted every Thursday morning. So you got to log in early on Thursday morning. You'll get put into a virtual waiting room. So it'll tell you, where in line you are, and it'll tell you roughly how long your line is. I'll tell you, I did this last Thursday to get an appointment for my own father. I logged in about 7:30. I had about an hour wait. I was, I think, 2,400th in line. But I was able to get in. I didn't get a vaccine because my computer crashed and some other IT issues, funny enough. But my friend logged in at 6:30. She was 500th in line and she got a vaccine. So it does work. You just need a little bit of patience. And during that time, if you just keep your web browser open, you can make a coffee, go get ready in the morning, and circle back when it's closer to time, especially if it estimates like an hour wait time. That's what I did. I just have my breakfast and my coffee and did just that. Then the next one is vaxfinder.mass.gov. This site is a little bit different from the first one in that it shows you a lot of other sites besides Gillette and Fenway. It'll certainly show you those sites, but it'll show you other CVS and other local sites too. And what it'll tell you is if there are open appointments. So you'll see a green check next to your site if there's any open slots, and it'll say no appointments available next to it if there are no appointments available. The only downside I've seen after doing my own kind of experimentation with this website too is that it's not the most accurate. It may say there's an updated appointment or an available appointment, but you still have to go onto another website to book your actual appointment. And by the time you go to that website, you'll see that that appointment may be gone, or maybe it was just inaccurate, or it didn't update recently or something. So that's kind of the only con, but those are both two good websites just to get a broad look at the scope and to see all the locations that are offering the vaccine. You can also go, because CVS is and Walgreens is giving the vaccines too, you can go directly to their websites as well and see what they have available too. That's actually what I did to get my dad, ultimately to get my dad a vaccine. I just kind of logged onto CVS one day last Saturday and saw that they had some openings, and I was able to book right then and there. You do need to have your insurance information. These vaccines do not cost anyone any money. You will never get charged, but CVS does ask for some insurance information. I'm not exactly sure why, but you're not able to advance on the booking platform unless you put something down. So make sure you have your appointment cards ready, appointment insurance cards and prescription insurance cards ready. A couple other things you can do. So if you don't have computer or internet access, that's okay. You can call 211 or call this number right here, and that's what will give you, it'll take you to basically a state-run hotline that will help you with any vaccine bookings. I will have to warn you that it's not going to be, it's going to be similar to as if you went online. So there are virtual waiting rooms that happen online. There's going to be a little bit of a waiting queue too for these phone numbers, because as you can imagine, everyone wants one of these vaccines, and you will get one, but it just takes a little bit of patience, some persistence. You can call that. If your PCP is, if you have a PCP, really anywhere, but particularly in our location, there's a lot of our residents will see someone at either MGH, the Brigham, Cambridge Health Alliance, BI Leahy, East Boston Neighborhood Health Center, the Lynn Health Center. All these places also have their own limited access to vaccines, and they are vaccinating their own patients, but they all have a unique way of booking it. I was just telling some folks on this call that at MGH, it's based on a randomized lottery system, but they are giving special weight to those folks in communities that were especially hard hit by COVID. So places like Revere and Chelsea. So if you haven't checked your patient gateway, your patient portals, your your emails, your voicemails on your cell phones, check them to see if maybe your PCP is trying to reach out to you to let you know that they have a vaccine spot open for you. Otherwise, it's a lot of just outreach. You don't necessarily need to call your own PCP, but someone will call you if there is a vaccine available. Finally, I know that East Boston Neighborhood Health Center is offering vaccines, not just to their own patients, but to any patients, all comers. So if you go to any other health center, they'll offer you vaccines as well. You can call their number here or visit their website to book. But again, all these places are all operating with a limited supply of vaccines. So again, a little bit of patience. Every week, we're constantly getting new shipments. We're constantly replenishing our supplies. So just try to be a little patient. I know it's hard to ask. We've been doing this for about a year, but this is, I think, just the last hurdle we have to get through before we're out of the woods. We can see the light at the end of the tunnel. It's almost there. So that's kind of basically it about what vaccines are available, where you can get it. That is in no way a comprehensive list of where you can get your vaccines. I know I missed a ton. I definitely don't know where all the locations are. And if Lauren, feel free to jump in if you know a couple other locations that our residents can go to. Obviously, our Revere Board of Health and our own senior center, we're doing a lot of outreach, phone calls to our elderly population. So we're going to keep doing that, and we're going to keep trying to get in touch with you all as well. But yeah, that's just kind of my take on the vaccines.
Yeah, that was amazing, Dr. Kong. And what I'll say in terms of, I know probably people are wondering what, as a Board of Health, as the city, kind of where we are in the vaccination process. We've given over 3,000 doses of the vaccine as of yesterday. And so, our ability to continue with clinics is dependent on the supply we get from the state, as is every other place that Dr. Kong just mentioned. And so we have been able to, not that we haven't been able to, we have had to work week by week in terms of standing up clinics, because we are notified of our vaccine kind of allocation every week, and it differs. It's never the same, and sometimes we don't get what we ask for in terms of first doses, and so we work within those constraints. We plan to continue to ask for as much as we can get, and whatever we get, we will, the residents of Revere will know about as soon as we know. And I know that's very frustrating. It's frustrating for us too. I wish that we had a regular, consistent supply coming in, and not even the entire state has that right now. And so, we are, what happens at the top reflects down to us. And so it's a frustrating process, but we're committed to continue in whatever way we can each week. We're doing clinics weekly. This week we're doing second dose clinics. We've started vaccinating our homebound residents, which has gone very well, and we will continue to do that as well. And that's kind of where we are as a Board of Health. We are in no way leaving the vaccination space. We just, we have to work with what we're given, and it's very, it can be very irregular and inconsistent. And so, we continue to work with that process, but, that's where we are as well.
Yeah, what I will also say is that if you look at the national data, Massachusetts is doing really well. We've vaccinated almost 20% of our entire population, which is great. We're so for all intents and purposes, we are moving through the phases, and we're getting folks who are eligible vaccinated as fast as we can, which is, and that's 20% of folks who've received a first dose, I should clarify. So we'll continue to go forward as fast as we can. So if you're not in a phase that's eligible for the vaccine yet, don't worry. We are going to go through them as fast as we can. One question I get a lot is, do you have to wait for one phase to be done before going to the next phase? No, we're not doing that. If we still have folks who are 65 or have 2+ conditions who still need a vaccine but haven't received one yet, that's not going to stop us from going to the next part of the phase in order to make sure all of our residents, everyone in the Commonwealth gets vaccinated, and we'll follow the lead of the state, and we'll make sure all of our residents get vaccinated too. So there's a lot of help out there, or a lot of websites out there that you can go to kind of educate yourself about the system and the process. It's all new to us. It's all new to everyone. Hopefully we'll never have to do something like this ever again. Hopefully it's a once in a lifetime thing to have to stock a random vaccine website. Like I never thought I'd have a Vax Finder saved as my favorites on my computer, but here we are. But yeah, hopefully we'll be able to kind of get through all this together. But everyone who wants one will get one. They will get one. This country is constantly producing vaccines, and we're constantly approving more vaccines to come to market just to meet the demands of the country. So we'll get there. We'll get there. Just, it may not be today, it may not be tomorrow, but we'll get there. All right, and that's kind of all I had. Does anyone else have anything else? Any other issues? Any other questions? No? All right. I guess what Michael says is, Nessa, what's up?
I just have a quick question for Lauren. I know you said something. I'm half asleep, so maybe I missed something while you were talking. I know they're inconsistent, and we didn't get no vaccines for the past couple of weeks. We've been doing a second dosage. I heard from Ed this morning, if I hope I'm not mistaken, that we're not getting any more because of the sites that they're thinking about doing somewhere in Wonderland or in Revere. Is that true? Like, we're not getting any more, or we just don't know?
Yeah, that's not true. We don't know. We don't know, and I don't, and I'm not just saying that because no one knows. But we continue to request doses, and we will continue to do that. And at this point, I'd say for the next month or so, it's going to be a week by week thing in terms of what we know we're getting. We are working. The city is working to try to bring other options to Revere. We don't have any specific details that we can say right now, but we are actively and hard at work to try to make that happen, to give residents another option within the city. And so hopefully we'll be able to give you more information soon about that.
Yeah, because he told us to tell people when they call that we don't have any vaccine. We haven't given any vaccine by the governor, and that they are thinking about putting a large site, and it's gonna be it's gonna be located somewhere in Revere, and it's gonna be open to everyone. So I know that with me telling people this on the phone, like this morning, few of them, they were mad. They're like, oh my God, we're gonna go back to the computer thing. We're not a computer savvy. If it's gonna be open to everyone, that means we're not gonna get on. I don't know what to do. And then most of them, they were over 70, the one I spoke to this morning. And then few of them, they even told me that they're gonna call the governor and blah, blah, blah. I just wanna make sure I'm giving the right information.
Yeah, so
be a big site, they freak out. They're like, okay, it's gonna be open to everyone. We're not gonna get on. That's it. We're not getting it. We're not getting it.
Yeah, so right now there's a lot of anxiety, and what you're describing reflects that this particular resident has a lot of anxiety in terms of feeling comfortable using a state website or using any website. That's why we have the call center in the senior, you know what I mean? That's why we have you guys up there taking calls. And those are people who will be able to help through the process. There is some degree of the state, every week looks different in this process. Every month is going to look different. Every phase that gets opened brings different challenges. And the phase that we're currently in, there's a lot more people than there are vaccine. And so, it's to a certain extent, we have to work within how the state's vision for future vaccinations will happen. And some of that is kind of reflective in the fact that giving a small number of doses to local boards of health isn't necessarily the most efficient way to give out vaccine. It's a good way, and I think that to some extent that will continue. I don't work at the DPH, so I can't give you any specifics in terms of what that I think that will look like. But we will continue to try as a board of health to make sure that residents first of all, to make sure that everyone knows what the most accurate information is in terms of where you can get a vaccine. Now, I don't have specifics more than what Dr. Kong just said about changes in terms of availability, in terms of locations for Revere residents. It is coming soon, but I don't have anything different to tell you tonight about what that looks like. But one of the things we're actively exploring is bringing a site to the city that's more centrally located, that's more accessible to public transportation, and that has more regular, consistent hours. So it's not a week-to-week kind of a reactionary approach, which is what we've had to do up until this point, because as a local board of health, we know only week by week what doses we're getting. So we're working towards that. And then the other thing, we are also going, our job is to try to help alleviate some of the anxiety around this. You can tell by the people that are calling in that there's a lot of anxiety around this topic, and everything is subject to change. This is something that I've learned over the last 4 months. Like you try to go out there and say you're going to commit to something, and then things get pulled out from under you, and through no fault of anyone, through no control, we have no control over a lot of the variables that we're trying to deal with. So to a certain extent, yes, is the move towards making more reliable, more open vaccination sites? Yes. And I think those sites are more efficient, but that doesn't mean that we won't also be available to help people navigate who don't feel comfortable. So I know that's kind of a long answer. That's kind of what I'd say is where we are.
No, that's very clear. Thank you.
Mm-hmm.
Any other questions? I think Mike says motion to adjourn. Can we do that?
Okay, motion to adjourn.
Yeah, okay, cool. Thank you, everyone. We'll see you all next month.
Sounds good. Bye.
Bye, guys.